Good morning, everyone. Thank you all for joining our virtual leader chat. We originally planned to spotlight MPAC's Strategic Communications Department today, but with return to office and back to school just a few weeks away, we know COVID-19 is top of mind for many. So we've pivoted, and today we welcome Dr. Brian Goldman. Dr. Goldman is an accomplished emergency physician at Mount Sinai Hospital in Toronto, a well-known health expert, medical watchdog, and host of the White Coat, Black Art and the Dose podcast. He's a leading voice in reform of the healthcare system, author of the book, The Power of Kindness, Why Empathy is Essential in Everyday Life. We're excited to have you with us, Dr. Goldman, to learn about the current COVID-19 situation, myths versus facts, vaccines, boosters, variants and concerns, and more. So we got a great hour planned. So, Dr. Goldman, we're very happy to have you here with us today. We're going to get started right away because we do have a lot of questions. As always, everyone, if you have any questions throughout the discussion, Carla's on the line. Carla, do you want to say hey? There she is.
Good morning, everyone.
So send in your questions. Carla's going to pop in throughout. All right, let's get to it. So we're in the fourth wave, right? Over the last couple of weeks, COVID-19 numbers have been on the rise in Ontario. Today, we're reporting 660 new cases, and we know 525 of those are in, not fully vaccinated folks, and only 135 in fully vaccinated folks. So what do these numbers tell us, Dr. Goldman?
So they're telling us that we are in the fourth wave. It started. The waves of COVID start small, but because of exponential growth, they can turn into very big numbers very, very quickly. Right now, the 7-day rolling average for COVID-19 cases across the province is 600. So today was 660. The number of ICU admissions is 156, which is well below the 800, 850 that we had during the third wave, which was really taxing the system. So right now, we can handle that number of critically ill patients with COVID-19. In general, as I've said, we have an exponential increase in the number of cases. Basically, what it means is that that from 1 week to the next, we're growing by 1.2, and it's like compounding interest. If you have a penny today and you double it, tomorrow you got 2 cents, but by the end of the month you're a millionaire. And so the 600 cases that we have on average every day over this 7-day period, it's been predicted that it's going to turn into 1,200 cases within 3 weeks, and it will double like that every 3 weeks. So within 6 weeks, it could be 2,400 cases a day, and within 9 weeks, it could be 4,800 cases per day. If we have that, we're going to be at the worst of what we had during the third wave of COVID-19. That's the bad news. The good news is that the majority of Ontarians right now who are eligible to get vaccines have been double vaccinated. So 75% of eligible Ontarians have been double vaccinated, which is great, much better than the United States. And what we're seeing is that COVID-19's fourth wave in Ontario is a pandemic of the unvaccinated. So it's unvaccinated people who are getting COVID. Although, as you can see, and we're going to talk about that, Jamie, in a little bit, why it is that why some people who've been double vaccinated can nevertheless get infections. But let's park that for a moment. This is a pandemic right now of unvaccinated people, and in particular children, because children under the age of 12 can't receive the COVID vaccine. So they're the ones that we fear are going to get it. Although the good news about kids is that when they get COVID, by and large, they get far less serious cases of COVID than adults, and in particularly older people.
Yeah, okay, so you're right. So there's two things going on here, right? So one is in the fourth wave, we've got Delta, and then we've got vaccines and the unvaccinated. So let's talk about Delta, right?
Yeah.
What do we know about it? Are the vaccines effective? Et cetera.
Yeah. So what we know about Delta is that it's a variant of concern, and it's the latest variant of concern that has come from the original COVID classic, the original COVID that began in Wuhan in China. It is 2 to 3 times more infectious than classic COVID. So if the original COVID, for every person who got infected with COVID-19, they could infect 1 or 2 other people. right now with the Delta variant, we think that any one person who's infected with COVID could infect 4 or 5 other people. So you can see that it's much more transmissible. The other thing that researchers have told us about the Delta variant is that it produces far more virus particles in the nose and in the mouth. And does it cause a more serious ailment? We're not sure about that. There are some suggestions that it might cause a somewhat more serious case of COVID, but what we do know for sure is that it's much more transmissible than the original classic COVID. You asked about vaccines. What we know about the efficacy of vaccines is that a double dose of Mrna or Pfizer is 95% effective against classic COVID. When it comes to the Delta variant, that drops down to about 65 to 70% in terms of whether or not you get COVID. But it's almost 100% effective, maybe 99% effective at preventing death, and maybe 95 or 96% effective at preventing hospitalization. So the message, the clear message that I want to state is that even though the COVID vaccines may be a little bit less effective against the Delta variant, they are still highly effective at preventing hospitalization, severe cases of COVID, and death.
Yeah, and then the other thing I was wondering about is transmission. So for those that are fully vaccinated, do they transmit it in the same way that those that are unvaccinated do when it comes to Delta or COVID in general?
That's a really interesting question, and that's something that researchers are looking at very carefully. What we at the moment, what research is telling us is that yes, you can transmit COVID, the Delta variant, even if you've been double vaccinated. But we think that there are significant differences between people who have been vaccinated and people who haven't been. People who have been vaccinated, they do have high virus particles for about a day or so while the Delta is incubating inside them. But that it goes away quickly, and the reason why it goes away quickly is that the immunity takes over and begins to dampen or knock down the number of virus particles. But so somebody who has never been vaccinated will have lots of Delta virus particles in their nose and mouth, and that's how they can infect other people, and that will be there for several days, whereas for people who've been double vaccinated, it will disappear. It'll be there for one day and then it'll disappear.
Yeah, okay. So we started to hear talk about, even now COVID 2022, I think was in the paper today, right? So are there other variants on the horizon for us? What do we know about, what happens beyond Delta, and what's some of the emerging signs? What's the medical community going to do to deal with them, do you think?
Yeah, so it's an interesting question, and we have to be, because the coronavirus mutates and it can mutate fairly rapidly, we have to be vigilant looking for new variants, and they go through several scientific classifications. They're called a variant of concern if there's solid scientific evidence that they are highly infectious, highly transmissible, or more severe than the classic COVID, or some combination of those. So we have a very small number of variants of concern. There's Alpha, that was the one that was the UK variant. Beta, that was from South Africa. Gamma, that was from Brazil, and then the Delta variant, which was originally described in India. We don't describe them by the country they came from, because that leads to labeling and shaming, but so now we call them Alpha, Beta, Delta, and Gamma and Delta. But for those, park those aside for just a second. We've got something like 22 variants that are of interest, and a variant of interest is a new strain of COVID for which there's a hint or maybe a bit of preliminary evidence that it might either be more transmissible or more dangerous, but there isn't solid scientific evidence. So there's plenty of variants that we're looking at. There's the Zeta variant, and there's the Theta variant, there's the Lambda variant, and I'm watching all of these, because if they get into Canada or the United States, it could cause a lot of trouble. What that tells us, and in particular, these variants of interest, which could become variants of concern and then begin to get into Canada, they start in countries where the vast majority of people are unvaccinated. If they're unvaccinated, that means that these new variants can incubate and multiply rapidly. And it's a reminder, Jamie, that it's not a zero-sum game when it comes to vaccinations. We want everybody across the globe to get 2 shots of the COVID vaccine, because if they don't, for the entire duration of time that they're unvaccinated or undervaccinated, they could become places where new and dangerous variants of COVID come, and then they travel to Canada and Ontario, and then they infect us. So that, we live in a global village, and we want everybody to be vaccinated, not just people who are privileged to get to be at the front of the line for a vaccine.
That's probably a great transition into talking about vaccinations, right? And one of the things we've heard a lot is, U.S. health officials have recently announced plans to start rolling out boosters, right? And here at home, we know some health units are talking about that for the vulnerable as well. So what can you tell us about the boosters, the plan for boosters in Ontario, and just generally what we're going to see for booster shots going forward?
So right now, the only official plan for booster shots in Ontario, or the rest of Canada for that matter, is in people who are immunocompromised. So people who have weak immune systems develop a very poor immune response to the first 2 doses of the COVID vaccine. They're given a booster to try to boost them to a level at which they can fight off the infection, at least to the extent that they can keep themselves out of hospital or worse, or keep themselves out of the ICU needing a ventilator, or possibly even dying of COVID. Boosters are not controversial in general. We have boosters to measles, mumps, and rubella vaccine. We have boosters to whooping cough, to chickenpox vaccine. So scientists have long recognized that immunity can wane over time, and that you need a booster. If you need a tetanus booster every 10 years to be protected against tetanus. So where did we get the idea of a COVID booster, a 3rd shot? Well, that came from Israel, where they had a very rapid deployment of double vaccination with the Pfizer vaccine. They had a contract with Pfizer that provided adequate doses to double vaccinate most of the population. That happened in December, January, February, just passed. And what they have noticed is that they have had quite a severe wave in Israel of the 4th of COVID-19, again, caused by the Delta variant. And as a result, they have noticed that a lot of the people who were double vaccinated nevertheless got fairly severe cases of COVID-19, and some of them died. And so they have begun to roll out or deploy a 3rd dose or a booster dose of the vaccine. And that's the basis upon which the United States, in fact, it was President Biden who announced that beginning in the fall, they would make a 3rd dose available to whoever wanted it and pay for it. And the idea there is to try to reduce the morbidity and mortality from COVID. Now, one of the reasons why they want to do it in that country is that they have such a substantial population of under-vaccinated or unvaccinated people because of vaccine refusal, vaccine hesitancy, because of politics, that permits Delta outbreaks to get higher, to affect greater numbers of people, and so present a greater problem to people age 60 plus, particularly people who are age 75 or 80 or 85 plus, who happen to live in communities where there are under-vaccinated or unvaccinated people. Whether the same thing would be true in Ontario, given the fact that we already have 75% of eligible Ontarians who've been double vaccinated, I don't think it would be as dangerous for people who were double vaccinated, say a year ago or 6 or 8 months ago, to be walking around and at risk of getting COVID. So anyway, the science is to try to boost the immunity of people who were double vaccinated a long time ago, say more than 6 months ago. But against that is the other point that I was making, that we live in a global village, and there are people who are taking the moral or ethical viewpoint that it's not fair for people who live in privileged countries, in privileged circumstances, to get a 3rd dose before people in developing countries have even had 1 dose of the COVID vaccine. So it's controversial, and I think we're going to need to see some incontrovertible evidence, some very strong scientific evidence that it's necessary to give people boosters before we see Health Canada approving a third booster, and the provinces like Ontario providing it.
Okay, so let's talk about the unvaccinated again. So as you say, we're 75% of the way there for the eligible population. And then we obviously have children, so the ineligible population currently, right? So looking at our children, what do you think is going to happen with vaccinations for children? Do we have any idea when the vaccine will be safe for children and available?
Yes, we do, Jamie.
Yeah.
So first of all, we're waiting for data. We're waiting for the first research studies. Moderna has been conducting research. Johnson & Johnson, Pfizer have been conducting research. The Pfizer study of kids age 5 to 12, so under the age of 12 and over the age of 5, is the furthest along. And we expect to see the results of that study around the end of September, beginning of October. And
soon.
I'm sorry, you were saying?
I say so quite soon then, yeah.
Yeah, so quite soon.
Yeah.
And I think that if the results are good and we have every indication that they will be good, there's really no reason why they shouldn't be good. Then I think that you're going to see initially emergency authorization for 5 to 12-year-olds, and they're anticipating that that's going to take place somewhere around American Thanksgiving, so about the third week in November. I suspect that Canada will follow suit fairly quickly. In other words, will line its regulations with those of the United States. The big problem will be ages 2 to 5, and I don't think we're going to see study results looking at ages 2 to 5 until 2022, and I don't think we're going to see a vaccine available for preschoolers until well into 2022, which means they will continue to be vulnerable to the effects of COVID. The good news, of course, and I want to keep stressing this, is that the risk of severe infection in kids ages 2 to 5 is small. The risk of being hospitalized or ending up on a ventilator much lower, and the risk of dying much lower. And in fact, in the United States, they've had 400 deaths in young children due to COVID. I'm not talking about teenagers. I'm talking about young kids. And that compares to 660,000 Americans who've died of COVID. So it's a small risk. However, when it's your child, you don't care what the statistics were. And when the media reports a bunch of a small, maybe 20 or 30 kids who are dying of young kids who are dying of COVID, it has a strong emotional impact on everyone, and we want to do everything that we can to try to stop it.
Okay, so we'll come back to how we can keep our kids safe. But now let's talk about the 75%. How high do you think we can go in Canada, right? What is the number for the pandemic to ease in Ontario and Canada? How high does that 75% need to go?
Well, 75% to 80% would have been good enough if we had just stayed with classic COVID or maybe the Alpha variant. But with the Delta variant, epidemiologists, the people who study population health, tell us that we really need to boost this to well over 90% of the population double vaccinated, and maybe even 95% double vaccinated. So we really have to get at the people. We have to vaccinate children. They are a large cohort who haven't been vaccinated, and just being able to vaccinate them will bring our numbers up much closer to 90%. But we still have to be able to approach or reach the people who are vaccine hesitant. And there are many reasons for this. It may be the information that people are receiving on social media. It may be distrust of authorities, distrust of doctors. There's a perception that the COVID vaccines have been rushed into use, when in fact the technology has been under development for about 12 years. So in fact it was fortuitous, it was fortunate that the mRNA vaccines were under development to treat Mrna, which was Middle Eastern respiratory syndrome, which was one of the other coronaviruses, and we need to be able to address the reasons why people are anxious. People might be hesitant of getting vaccines because they're concerned. They have kids. They're concerned that they're breastfeeding, or that they might want to get pregnant, and that's going to pose a risk to their child. And what we need to do is dispel any of those anxieties. That there is no risk for pregnant women that it's going to affect their unborn child. There's no risk with breastfeeding. You know, we've now had vast experience with the COVID vaccines that have been available since the beginning of the year, and we have had no signal whatsoever that there are harmful effects on unborn children or breastfeeding children. And so one by one, we need to address these anxieties and communicate with people where they live, with people they trust, and provide the information in ways that can be understood, and do it in an empathetic way, not in a condescending way, like saying you're wrong, you're endangering people by being hesitant to get vaccinated. And the reason why I'm stressing this is that of anything that you can do, wearing masks, washing your hands, they're all good, practicing physical distancing, the most important thing that any of us can do is get vaccinated, get double vaccinated. It makes returning to the office possible. It makes returning to our lives possible. It makes it safer for our children in our homes. It makes it safer if we're bringing our children to daycare or bringing our children to school, if teachers are double vaccinated, if the support staff in schools are double vaccinated. So that's the reason why I think it's worth stressing this again and again.
Absolutely. Okay, so that's probably a good lead into our first poll. Oh, Carla, before the poll.
Not so quick, Jamie. Thank you both for this wonderful discussion. We're getting a lot of questions from our colleagues, many of which you're going to cover anyway, but some are new. So I just wanted to bring up a couple. The first one is there's been talk about potential going into a potential fourth wave here in Ontario or in Canada. And if we go into a fourth wave, do we anticipate that it would be it'd require a lockdown as the previous waves have?
So that's a bit of crystal ball gazing, which you know, I think the short answer to the question is that we are already in a fourth wave, and are we going to? We're already getting exponential growth, and the modeling that we're hearing from the Science Advisory Panel in Ontario suggests that within 3 weeks we're going to have 1,200 cases per day. That's manageable, but if we you know, and the modeling always takes into account how stringent our controls are. I think that if we get back to 4,800 cases a day, we're going to be in lockdown. And in fact, we're going to be in lockdown before we get there, because there's going to be this effort to try to turn the battleship or turn the aircraft carrier around or stop it or change course. And you know, based on the behavior of most provinces, not just Ontario, but right across Canada, with the exception of the Atlantic provinces, which I think have always taken this more seriously, we tend to react well after we should have started to consider lockdowns. And we will lock things down if the case counts go up and we see that we're starting to get many more people admitted to hospital, many more people admitted to the intensive care unit, which is straining our healthcare system. And I would also add, as something that's different from the third wave, if we start to see that we have run out of pediatric ICU beds because we have more children than we can handle who are on ventilators, then I think we might start to see lockdowns happening sooner. Those are the kinds of things that we're going to be looking at. Just keep in mind that admissions to hospital and ICU admissions tend to occur 3 weeks after we start to see a serious increase in the number of cases. So you know, it's incumbent on public health and authorities to be watching these numbers very carefully. And you know, the more people get vaccinated, so if you're hesitant, roll up your sleeves now, because you're going to be helping to contribute to stemming this fourth wave. But the other thing is, you know, this is not the time to get rid of masks. You know, when you go into a store and you suddenly see more people there than are supposed to be there per the regulations, and there's nobody to enforce it, put your mask on, because you'll be helping them and you'll be helping yourself if you do that. Wash your hands. This is not the time to be cavalier. It's okay to be outdoors without a mask, but when you're indoors with unfamiliar people who you don't know, they could have Delta, then you should take precautions and err on the side of caution instead of throwing caution to the wind.
Okay. All right. Now I think it's a good time for the first poll. All right. So Carrie, Justin, you want to throw that up? All of these are of course voluntary, but if it's offered, would you get a COVID vaccine booster shot? Right. Give that a second and we'll take a look at the results. And then after the poll, we're going to jump into some of the advanced questions that we've got, because I want to make sure we cover those from staff.
Maybe during the poll question, Dr. Goldman, if I can ask you another staff question that we received live today, and that is, are you able to speak to how are, how's the medical industry and the scientists, how are they figuring out the effectiveness of the vaccine testing, whether it's testing in children or testing in adults? How do they measure the effectiveness of each vaccine?
So basically what they're doing is they are either administering a vaccine or a placebo to kids, and this is the same as adults. And then after that, they're doing nothing else but observing how many cases of COVID-19 occur in the vaccinated kids versus the unvaccinated kids. And they're also measuring other signal indicators like how many are admitted to hospital and how many end up on ventilators. And the challenge here is to recruit enough children that you can discover a statistically significant difference in the number of cases. What they're looking for is a lower number of cases in the kids who've been vaccinated compared to kids who weren't, and they're also looking for a lower number or even a zeroing, because that's what happened in adults, a zeroing of the number of kids who were admitted to hospital and who ended up on a ventilator and worse, and heaven forbid, who died. And the challenge here, compared to adults, adults are more likely to get infected with COVID or more likely to have symptoms of COVID. So you don't have to recruit as many adults as children to get a statistically significant difference. And so the statisticians, the scientists have to make sure that the study is adequately powered, which means that it has enough kids to be able to tell that statistically significant difference. Now I'm going to add one more wrinkle to that, and that is that the Food and Drug Administration in the United States asked Pfizer to extend their study. You may have heard about reports in the media of young kids, in particular males more than females, getting inflammation of the heart. It's called myocarditis, and they wanted to look at a longer sample, a larger sample, just to get a more robust result as to how likely it is that kids can develop myocarditis. It doesn't seem to be a severe ailment, but it is something that needs to be treated. You need to be followed by a pediatric cardiologist. You need to have an echocardiogram. You could get heart rhythm disturbances from that. And so they want to find out just how likely that is, and learn more about who's getting it, so that maybe they can offer some way of preventing it, or maybe one vaccine is more likely to cause it than another, so they can say that kids should receive in preference the Mrna vaccine, and I'm being hypothetical here. So that's the reason why, yeah, and that's how they do the study.
Okay, so overwhelmingly, it looks like MPAC staff would be interested in a vaccine booster shot, which, as you say, once further direction comes, seems like a pretty good result. And as you say, speaks to maybe the willingness of our staff to roll up your sleeves, as we were talking about. Okay. All right, let's dig in some of those staff questions that I mentioned. So we hear that some people can't get vaccinated for medical reasons. Is this possible? And can you give us an idea of some of the medical reasons that would prevent someone from being vaccinated against COVID-19?
So the main medical reason to not get a COVID vaccine are a severe anaphylactic reaction after a previous dose. So anaphylaxis meaning, like having a peanut allergy or an allergy to penicillin or a bee sting, where you get sudden swelling of the tongue and the mouth and severe trouble breathing. You may collapse. This is something that we treat with an EpiPen. So people who already have anaphylaxis or have kids with anaphylaxis know exactly what this is about. So if you get, and that's why we make people, and I've been a vaccinator at Scarborough Health Network in Toronto, and that's why we make people wait 15 minutes to make sure that we don't miss that, so that we can treat it. So a severe anaphylactic reaction after a previous dose or to a component of the COVID-19 vaccine, or an immediate allergic reaction of any severity to a previous dose or a known or diagnosed allergy to a component of the vaccine. The main components that we're talking about are polyethylene glycol, or PEG, which is an ingredient in both messenger RNA, mRNA, Moderna, and Pfizer vaccines, and polysorbate 80, which is an ingredient in the Janssen COVID-19 vaccine. The Janssen vaccine is not something that we've seen in Canada. PEG and polysorbate are structurally related, and so if you're allergic to one, you could be allergic to the other. Those are the contraindications. There's no diseases that are reasons why you shouldn't get the vaccine. If you have a weak immune system, it's not that you shouldn't get the vaccine, it's that the vaccine may not be 100% effective in you.
Okay. With school on people's minds, we have a couple questions here about how to keep kids safe. So, I think that's basically the question. Like, we know kids below 12 can't get vaccinated. So what are some of the things we can do to protect children, especially as they're heading back out to school in September?
So first of all, the Delta variant, which we've already talked about, is responsible for various serious outbreaks of COVID in the United States. But this is coupled with quite low vaccination rates in some states. Overall, Canada has much higher rates of vaccination than the lower vaccination rates in some parts of the United States, some parts of Florida, for instance, Mississippi, and Tennessee, and some other states in the United States. What that means is that while we will have a fourth wave, it's not going to be as severe as in the United States. The things that you can do to protect your children, I've already talked about them, but they are worth repeating. Get vaccinated, get double vaccinated. Have your kids wear masks and practice physical distancing at school. Have them avoid large indoor gatherings, indoor parties, that are not recommended. Follow public health guidelines. If you're going to have large gatherings, it's better to have them outdoors than indoors. And I guess the other important thing is to pay close attention to reports of local outbreaks, so that if the fourth wave does get out of control where you live, be prepared to follow instructions from public health. And let's hope. We know that our children have suffered grievously, mental health challenges from not getting the benefits of the interactions that they have at school. We want to keep things open. The way to do that is to get vaccinated and to wear masks, to have your kids wear masks, and if we do that, maybe we can, stem the worst of, keep the worst of a fourth wave from happening. I'm certainly optimistic that we can do that, and we want to encourage people to follow the rules, because that's the way out of the pandemic.
Yeah, absolutely so. Okay, so you mentioned parties. We got a question about parties here. So my daughter recently attended a birthday party where there are large bowls of shared snacks. Is that safe? And do you have any recommendations for hosting or attending social gatherings? I think you picked up on some of them already, but what do you think about that?
Some of them we can go over very quickly because they do bear repetition. Since 10-year-olds can't be vaccinated, they remain at risk of getting COVID, especially during Delta. The Toronto Public Health recommends holding birthday parties outdoors, where increased ventilation makes transmission of COVID less likely. They also recommend serving individual instead of shared snacks. If indoors, you should keep the numbers down to what public health says is permissible, and the kids should be as physically distant as you can make it indoors, which is why we're recommending outdoor instead of indoor.
Yeah, very much so. Okay, so that brings us to our second poll question. So maybe we can pull that one up, and then you and I can talk about sort of, as you say, doing a bit of crystal balling, looking into the fall a bit. So here's our second question. Do you think the province should implement a province-wide vaccination certification program? Right. And I know one of the things, Dr. Goldman, we're seeing in the news is sort of like it's a bit of a trade-off, right? If we do have a certification program, does that help mitigate, or is that a policy option instead of a lockdown, do you think, right?
That's a really interesting question. Of course, I don't want to bias everybody's opinion, while they're answering.
Yeah, well, yeah.
But I think that a vaccine certification program could be a major driver of people getting double vaccinated. And if that happens, personally, I'd be in favor of it, because I like the idea of anything that we can do to encourage people, providing some kind of it would be nice to provide a carrot, to provide benefits to people. And there's no question that if you are double vaccinated, the world is going to be more open to you, not just from a standpoint of travel, but from a standpoint of how risky it is for you to go to a cinema or to go to a sporting event. We all want to be able to return to as much of a normal kind of life as we can. And certainly a vaccine certification program would make it a lot easier for individual companies to enforce vaccine policies, or strongly encourage people to be, or at least strongly encourage people to be double vaccinated before they return to work in the office.
Yeah, and as you said, we're starting to see that, things like the Jays game and stuff, right? So where it's like, get a test or, show proof of vaccination. So, okay.
Yeah.
Very similar to our last results, actually. Strong support from the group for this type of program, which is cool. Okay, so let's look into the fall a little bit. We've talked about some of this already, but we're thinking about the fall. Flu season's coming up. What are your thoughts about the flu shot? Should people get the flu shot? Can you get the flu shot and the COVID vaccine shot together? Will they conflict each other? How does the flu and COVID, how do they work together, and how do those two vaccines work together for us?
So there's a fascinating relationship between flu and COVID. I don't know if you've had a flu, a case of the flu since the pandemic began, or even a bad cold. And I think a lot of people have noticed that they haven't had a bad cold, hardly been sick, hardly had a sore throat since the pandemic began. And we first noticed this in Australia. They have their winter when we have our summer, and during the pandemic they had their first flu season during the pandemic. They had the mildest flu season that they'd had in decades, and that's exactly what happened here in Canada, here in Ontario. So what's going on there? Well, one thing is that we've been practicing infection control measures that we have never practiced before. We've been wearing masks, we've been washing our hands frequently, we've been staying away from other people, physically distant from other people, and so if we continue those measures, we're probably going to continue to enjoy not being as infected. We're not going to get those other wintertime infections like flus and colds that we usually get. On the other hand, kids, it's hard to make young kids, it's hard to make kids in daycare, preschoolers wear masks all the time. And so to that extent, they're going to be more likely to share germs with one another. And some Western countries are noticing an increase in cases of flu, in cases of a virus called RSV, which is respiratory syncytial virus. And so we have to be vigilant to that. That's probably going to happen, and it's going to happen in younger kids because they don't reliably wash their hands and mask in the same way that older kids and adults do. Now, to answer your question about the flu shot, I get a flu shot every year. I have to tell you that the flu shot is not nearly as effective as the mRNA vaccines, the Pfizer and Moderna vaccines are against COVID. In a good year, a flu shot may be 50% effective, 40 to 50% effective. I still get it because if I get the flu, I'm going to have a much milder case, and we know that the flu annually kills probably 1,500 to 2,000 Canadians from diseases like pneumonia, congestive heart failure. So I give it. Now, get the flu shot and the COVID shot at the same time? No, you can't. And that's because we don't want to overtax your immune system. So you should be at least 2 weeks after your last vaccination before you get your next COVID vaccine, for instance. So we need to space them apart.
Yeah. Okay. No, I was chuckling there because I have a 2-year-old. So yes, it is very hard to get 2-year-olds too.
Oh, it's like,
yeah, just like please stop putting your fingers in your mouth. Yeah, now is not the time for that. Yeah, but hard to enforce that, you know. But on the flip side, I have a 5-year-old and she's been very good about wearing her mask. So, you know, they know how to do it in kindergarten these days. It's going to be weird to go to school and take the mask off, yeah, for her. But I look forward to those days.
You'll be a role model, maybe.
Yeah, no, exactly. Yeah. She started school with the mask on. So speaking of masks, right, let's talk about masks, and because we're going back to the office at MPAC. In many office spaces, you're encouraged to wear a mask at all times unless you're able to physically distance for at least 2 meters. So one of the questions we've had is it okay for me to take off my mask while I'm at my desk?
You know, if you are double vaccinated, in my opinion, it's okay to take your mask off. You know, if you work alone at your desk, particularly if you're well more than 2 meters away from other people, if you're working with a reduced staff, because some people continue to work from home. You should wear a mask continually if you can't stay physically distant from coworkers. You should eat alone. You should definitely not congregate in lunchrooms and cafeterias. Taking your mask off at work is safer if everyone at the office has been vaccinated. So that's yet another reason for being double vaccinated.
Okay. And the other thing that contributes to that is ventilation. I don't know, we've had some questions already from folks. So I wanted to just remind everyone that we've covered off ventilation in the FAQs, right? So I encourage everyone to make sure you read those. And I just want to remind everyone that Facilities has been working with our various landlords throughout the province to ensure that our HVAC systems are maintained on a regular basis, including things like increased frequency of filter replacement, increased fresh air intake, right? So let's talk about what difference those things make, right? Like how big a difference does better filtration, better air intake, does that make a market difference, you know, when we're inside?
Yes, indeed it does. And you know, one thing that we know, if you were to ask me, what do we know today that we didn't know a year ago, or we weren't sure about a year ago, it's that COVID is airborne. And what that means is that those tiny microscopic particles, virus particles, can kind of stay suspended in the air for many minutes to hours in the circulating air. And you know, in the beginning of the first wave of COVID, we thought that COVID was primarily droplet spread, which means, you know, drippings from your nose or sneezing and coughing onto surfaces, and that you would touch the surface and then touch your eye and touch your nose or mouth. I said it on the radio many times, and frankly, that's not the way you get infected. But what that led to was this belief that if we are obsessive with cleaning surfaces, we're gonna prevent people from getting COVID. When it turned out that made very little difference. What made a bigger difference was masks. So why, when you wear a mask, you're actually blocking virus. If you're infected from infecting other people, and if other people are infected, the mask is preventing you from taking in COVID germs. So the implications of COVID being airborne is that ventilation is the critical piece. You know, air filtration is important too, but between the two of them, ventilation is absolutely critical inside offices. It's the reason why being outdoors is so much safer than being indoors. And that's because you have many more air exchanges per hour, like 15 air exchanges per hour when you're outdoors compared to being indoors. So to make the air safe indoors for a large enough people to go back to the office, since COVID is airborne, offices need to boost ventilation. The easiest and fastest way to do that is to open the windows. But failing that, you know, HVAC systems, a really good HVAC system will provide 4 to 6 air exchanges per hour, or once every 10 to 15 minutes, which is what you need to be able to. That means that you're replacing the air every 10 to 15 minutes by fresh outdoor air. If you do that, then it's going to be effective. And if the office doesn't have adequate ventilation, then filters can catch tiny particles. Ideally you want a HEPA filter with a MERV 13 designation or higher. The office can also purchase portable HEPA filter machines throughout the office, and a HEPA filter properly set and properly sized for the room can filter at least 99.97% of particles that are 0.3 microns in size, which is well within the wheelhouse of COVID-19. Our big concern is, have the schools been upgraded? I have no doubt that forward-thinking companies like MPAC and others are taking care of this issue. I have a lot more concern about schools, that they have upgraded, that they just knowing the slowness, the inertia with which changes occur in schools and upgrades occur. They're always cash strapped, and it's up to the individual school boards to make their decisions on what they're going to do. But for major corporations, I have no doubt that they're taking care of this.
Okay. So we talked a little bit about Carla, you go.
Yes, I have many questions before we log off with Dr. Goldman here, but one of them, you're talking about masks and being indoors in those spaces. So with the Delta variant of concern being more contagious and more transmissible to even vaccinated individuals, are non-surgical masks a protective measure to prevent transmission?
So stay tuned. There may yet be changes in recommendations, but right now, non-surgical masks are considered adequate, especially if you're double vaccinated. If you want extra protection, you can certainly wear an N95 mask. Certainly in terms of fit and efficacy, a well-fitted surgical mask is better than a non-medical mask. So it has to go from the bridge of the nose to underneath the chin, and you've got to replace them. You can use them for an 8-hour shift. If you have to take them, if they're soiled, you need to change them. At meals, you should probably, if you take them off for meals, you should probably replace them with a fresh mask. But if you wanted to go to an N95 mask, some people think it's necessary. I don't think it's absolutely necessary. But particularly if you happen to live or work in an area that has a high rate of Delta, so stay tuned. Then I would consider switching to an N95 mask under those circumstances.
Now, is that true for kids as well? Because I find it's hard to get the surgical masks fitting well on kids. So is that same, or is it kids, are they better off with the cloth mask that you can sort of dial in?
I think you've got to be practical and do the best that you can. You're looking for a mask that fits from the bridge of the nose to underneath the chin. I like ones that don't go over the ears because they tend to cause discomfort, and your child will be picking at it, pulling it off. One that ties to the back of the head instead, I find, is better than the ears. And if you are going to choose a surgical mask, it has to be a pediatric surgical mask. It has to be sized to your child's face.
Yeah.
So talk to the pharmacist if you're buying it in the pharmacy and get advice.
Okay. All right. So looking ahead, you said you're optimistic about the fall. So where do you think, if you had a crystal ball, what is your prediction? For what COVID's going to look like in the fall and winter season for us?
Well, I think that because we have vaccinated so many Ontarians, I'm optimistic that we'll be able to stem the increase, and if we have some luck and we have an early emergency authorization for the COVID vaccine in kids ages 5 to 12, then just doing that will, of course, it'll take a while to properly double vaccinate those kids. Once we get there, we're going to be boosting somewhere close to 90 to 90%, and so my crystal ball says that we are going to have, at least initially, a somewhat rough fall. I'm pretty sure we're going to see a doubling of cases in 3 weeks, and we may see a quadrupling of cases within 6 weeks. But it's up to us. If we get vaccinated, if we wash our hands, if we wear masks, then that peak won't be as high as it would have been, and maybe the government won't have to take more stringent measures. But there is nothing unusual about waves during a pandemic, and it's not unusual to have a fourth wave. And so the best news I can tell everybody is that pandemics all end. And this one will come to an end, and the way that it's going to come to an end is as the world gets vaccinated, we'll have fewer and fewer of those variants of concern, and we've certainly learned a lot about infection control. So overall, I remain optimistic, in part because I know there are things that we can do, and the most important thing is to get vaccinated and continue to listen to public health, wear masks, and in particular, take special precautions when you're indoors and you know, with people who are unfamiliar, but stay on top of, you know, the case counts, and know you know, whether things are getting out of control where you live, because if they are, then you know you need to be more vigilant. But we will get through this.
Yes, we will. Yes, we will. Okay, great. Carla.
Yeah, and I don't want to get through this VLC with these last 3 questions that I have, so I know we're a little over, but Dr. Goldman, if you don't mind, quick rapid fire questions. So the first one, for those who receive the Astrazeneca vaccine, do they need an mRNA booster sooner than later? Are they more at risk?
They need, they're not more at risk. You know, the AstraZeneca vaccine conferred significant immunity after the first dose, somewhat less than the Moderna or the Pfizer first dose. But the good news is that if they receive a Pfizer dose or a Moderna dose after they receive the AstraZeneca vaccine, say within 8 weeks, their level of immunity will be as good, if not better, than if they receive 2 doses of Moderna or 2 doses of Pfizer. So get that vaccine and boost your immunity.
Thank you. The next question, some vaccine hesitancy stems from not knowing what the long-term side effects may be. Do you have any advice for those individuals?
Yeah, you know, certainly the longer we go out, the more we're learning about the intermediate and longer term side effects. There has never been a vaccine in the history of vaccine manufacture that has caused some very lengthy, you know, some side effect that occurs 5 years out. If we're going to see a signal of some long-term serious impact, it usually occurs within 6 months to a year. We're getting into that ballpark where I think you can be pretty confident that we're not going to see any unexpected long-term side effects of vaccines. So that's the best I can say. I don't know for sure, but that's not happened in history. That's not how vaccines work. And this is not a drug. It's something that primes your immune system to fight off a particular infection.
Great, thank you. And the final question, so for those who may have contracted COVID in the past few months, are they immune, therefore not needing boosters? And are there individuals that are getting COVID more than once?
Yeah, there are individuals who are getting COVID more than once, and unfortunately, if you received COVID, if you got COVID, if you were diagnosed with COVID, that does not mean that you are immune. Partly because the new variants of concern become more transmissible, more infectious, and they lead to what are called breakthrough infections. Same thing can happen with people who are vaccinated. Doctors, public health specialists, infectious disease experts recommend that you receive a full series of vaccinations after you have had a COVID infection, and that will boost your immunity by giving you not only protection to the original version of COVID that you were infected with, but subsequent variants of concern as well.
Okay, great. So thank you everyone that sent those questions in. We're heading towards the noon hour here, so I think we'll wrap up. So first of all, Brian, thank you so much for joining us. I want to thank the VLC team for all the prep they did, and thank you to everyone that joined and sent in questions today. Next week, there's going to be no VLC as we're getting ready for the long weekend. So join us on September 8th for an Ask Us Anything with the Executive Management Group. And if you have any questions for that, please send them into communications@mpact.ca by Monday, September 6th. So thanks so much, everyone, and we'll see you soon. Bye now.